This audio overview is generated using AI for educational purposes by Cary Family Dental and does not replace a consultation with your dentist. Imagine finishing a standard prescription, throwing the empty bottle away and just thinking you're completely in the clear.
Right, you think it's over.
Yeah, but then like up to 2 whole months later, you suddenly develop severe abdominal pain and a fever.
Oh yeah, that delayed ambush is actually one of the hidden risks of antibiotics.
Exactly. So our mission today for this deep dive is to really understand these adverse effects and figure out exactly how to protect your body when you actually need these life-saving medications.
Because, while antibiotics are incredibly effective at saving lives, they kind of lack surgical precision.
Yeah, it's like taking a powerful bulldozer into a dense forest.
That is a perfect way to put it. When you use an antibiotic to clear out a dangerous infection, it knocks down the immediate structural threat, but it also accidentally wrecks the landscape.
Right, it strips away the healthy trees, which is your good protective bacteria.
Exactly. And when you clear-cut a forest, you leave all that empty, unprotected soil. This basically leaves room for two main adverse effects. You either get a massive system alarm, which is your immediate allergic reaction, or you get invasive, poisonous weeds taking over the digestive tract, which is the bacterial overgrowth.
Wait, hold on a second. Because digestive issues, like nausea, that can be a sign of an allergy, right?
Yeah, it can be.
But then diarrhea can be a sign of bacterial overgrowth. So how are you supposed to tell the difference when the bulldozer is, already in motion and you're feeling sick?
Well, it comes entirely down to the timeline and the severity. So allergic reactions are the immediate alarm bells.
Like right away.
Yeah, you take the dose, and within minutes or maybe a few days, you might see hives, rashes, wheezing, shortness of breath, or, like you said, those early digestive issues like nausea and abdominal cramp.
Okay, so that makes sense for a fast-acting allergy, but what about the overgrowth of those poisonous weeds, the bad bacteria?
Right, so that is the one operating on that shocking delay. If you are experiencing severe diarrhea, intense abdominal pain, or bloody stools weeks after finishing your prescription.
Or even up to 2 months later, right?
Yes, exactly. Up to 2 months later, that is not a lingering allergy. That is the gut overgrowth taking hold.
Wow, that's terrifying.
It is. And the most severe form of that overgrowth is a condition called pseudomembranous colitis.
Okay, pseudomembranous colitis, what is that exactly?
It's essentially a really dangerous, severe inflammation of the colon lining. And it's usually caused by a toxic bacteria called C. diff.
Oh, I've heard of C. diff.
Yeah, it's bad news. And while several antibiotics can trigger this, it is very strongly linked to one called clindamycin.
Why clindamycin specifically?
Because clindamycin is particularly aggressive against anaerobic bacteria, which unfortunately means it just heavily wipes out the specific good bacteria that normally keep C. diff in check.
So by taking out the guards, the medication just leaves the door wide open.
You got it. That means anyone taking these medications needs to be on high alert. Obviously, if you have a history of adverse effects or, family history, your danger level is higher.
Right. So what is the action plan if those severe delayed symptoms actually hit?
If they hit, you have to stop the antibiotic immediately and call your prescribing doctor right away. You cannot just wait and see.
Okay, so say the bulldozer already went through. How do we reseed the lawn?
Well, you shouldn't even wait until the medication is finished to start repairing the damage. You need to actively replant that cleared forest by taking a high-quality general probiotic blend.
For how long?
For the entire duration of your antibiotic course, plus 3 full weeks after you finish.
Okay, that 3-week extension makes perfect sense now, considering that crazy delayed risk of overgrowth. But looking at the recommended defense protocol here, there's a really specific instruction. It says the probiotic needs to contain 3 to 5 billion CFU, which, for you listening, just means colony-forming units, basically the number of active live microbes of something called Espellardia. Why that specific organism?
Because Espellardia is actually a yeast, not a bacteria.
Wait, so the antibiotic just ignores it?
Exactly. It's a crucial distinction. Antibiotics are designed to kill bacteria, so they'll wipe out standard bacterial probiotics if they cross paths. But the bulldozer completely ignores yeast.
That is brilliant.
Yeah, so the Espellardia survives the medication and acts as a sort of temporary placeholder in your gut. It crowds out the bad bacteria until your natural microbiome can recover.
Okay, but for the rest of the bacterial strains in your general probiotic blend, they're still vulnerable, right?
Very vulnerable.
So there has to be a strict timing strategy. Otherwise, you're just swallowing good bacteria only for the medication to instantly destroy them.
Yes, there's an absolute golden rule for timing here. Never, ever take your probiotic within 2 hours of your antibiotics.
So space them out by at least 2 hours.
At least. You have to give the medication time to process and clear the immediate area before you start planting new seeds. Otherwise, you just completely wipe out all the benefits of the probiotic.
Wow, okay. You know, this really leaves you with a profound realization about the human body.
How so?
Well, I mean, if a single routine prescription can silently alter our internal landscape so drastically that the consequences hit up to 2 months after the bottle is empty,
Yeah.
it just makes you wonder how much of our everyday health, our immunity, and even our mood is quietly governed by this microscopic world that we completely take for granted.